Hey guys, so if you tuned into our live over the weekend, so you caught us discussing male sexual dysfunction where we discussed low libido, uh, ejaculatory disorders, erectile dysfunction, and anorgasmia. And in our discussion, and in case you missed it, we've saved the live on our page, so you can just go take a look and see what we discussed. It really was a fun discussion, but enlightening discussion as well, yeah. So in our discussion, we discussed how these issues sometimes coexist. So a man with erectile dysfunction can have low libido, and because they coexist, a number of times the causes tend to be the same, yeah? So we discussed medical causes such as diabetes, where Dr. Hilda was there to guide us through, hypertension. We discussed medications such as antidepressants like SSRIs that may be associated with some of these issues in men. We discussed chronic alcohol use that can be associated with low libido. We discussed a variety of causes, including psychological causes, where most of the times we find that a lot of the men with these sexual dysfunction issues either have issues from a past relationship or a current relationship that they're in. So this is something we ask about when you come into the office. We want to know how your current relationship is, if there are any issues between you and your partner, if your partner also has a sexual dysfunction issue. So if the woman also has a sexual dysfunction issue. So if the woman also has, let's say, dyspareunia or low libido as well, then the man may, the two conditions rather may coexist and may be related, yeah. So management generally depends on the cause. So if there's a medical issue, we want to assess and see the medications you're on, assess and see whether we can change the medications that you're on or see how to help you. If there's a psychological cause, that's where therapy comes in and sex therapy comes in. And this helps and just like we had discussed when we're discussing low libido in women, this helps the couple communicate better. It helps the couple understand each other's sexual needs. It helps the couple, look for a way together with the therapist to have a satisfying sex life. Yeah, and so at this point is where we usually refer you to a sex therapist if need be, if there is no medical cause that we can address. Yeah, like I said, the conditions sometimes coexist with other male sexual dysfunction disorders. So if the man also has erectile dysfunction, then the role of oral medications like Viagra can come in handy. The role of injectable, what we call penile injections, can come in handy. The role of intraurethral creams can come in handy, like alprostadil. There's also a role of, we discussed yesterday, the pump devices that you can use, and also the role of penile prosthesis. So all this, your doctor will assess and then figure out the best option for you. Yeah, so if you haven't, please watch our video, the one we shot over the weekend. It really will address any of the concerns that you may be having as relates to matters male sexual health. And if you have an additional concern or query, hit us up on our DM. You can also send messages to our private messages. Our contacts are always linked there. And let us help you, because sexual health matters are really not talked about as much as we would like. Yeah, so we're trying to create a space here that makes you feel comfortable enough to open up to us. So have a lovely, lovely rest of the week, guys.